Mr. President, yesterday, President Trump and congressional Republicans went to the White House to celebrate the passage of tax legislation that was partisan, that was rammed through the Senate earlier this week, without one public hearing. Now, debate on this bill in the Senate is over. But I think we must not lose sight of the impact this legislation will have on so many families and on our economy. Because make no mistake, this tax bill is not tax reform. Instead, it asks middle-class families and future generations to foot the bill for massive tax breaks for large corporations and the wealthy. By adding over $1 trillion to the national debt, this tax plan will undermine our ability to address so many of the real challenges that face this country and middle-class families in America. Indeed, Republicans have already made clear that this tax bill is just step number one. What we've already heard from members of the House is that step number two is going to be next year, and that includes deep cuts to Social Security, to Medicare, and to Medicaid. They're saying we're going to have to do that to address the deficits that have been made far worse by this bill. Now, meanwhile, the majority's headlong rush to ram through this tax bill has meant they've jeopardized access to health care for tens of millions of Americans. My colleague from Ohio just talked about so many families in his state that are worried about losing the children's health insurance. We're seeing that in New Hampshire as well, and across this country. By considering only stopgap, short-term reauthorizations of critical health care programs, fear and uncertainty has been created for countless American families. Because the Congress has failed to enact a long-term reauthorization of the Children's Health Insurance Program, we have health coverage for nearly 9 million children across the United States that is at risk. Congress has failed to enact a long-term reauthorization of the community health centers, which more than 25 million Americans rely on for essential health care. And according to the nonpartisan Congressional Budget Office, the tax bill's repeal of the individual mandate means that nearly 13 million fewer Americans will have health coverage in the next year, and many millions more are going to pay increases in their rates. Now, in addition, the majority has also failed to enact a long-term reauthorization of the Special Diabetes Program, and that is a devastating blow to nearly 1.25 million Americans who are living with type 1 diabetes. All of these programs have earned strong bipartisan support. That's what's so hard to understand about this. All of these programs should have been fully reauthorized for the long term, because I know my colleagues in the Senate support these programs. But once again, we have missed a prime opportunity to address the opioid crisis. We desperately need a federal response to the opioid epidemic that includes robust, sustained resources that match the scale of this epidemic. Just this week, we learned from the Centers for Disease Control and Prevention, the CDC, that because of soaring overdose mortality rates, life expectancy in the United States has declined for the second year in a row. For the first time since the early 60s, we have seen the second year of decline in life expectancy because so many people are overdosing because of substance use disorders. 63,000 people died from overdoses in 2016. 63,000. If we were losing that many people to a war in the Middle East, there would be an outcry in this country. I want to know where the outcry is and when is this body going to act? On Tuesday, the University of New Hampshire released a study that cited a 5-fold increase over the past decade in our state of babies that were born addicted because of their parents' substance use disorders. And yet, in the face of this uncontrolled national public health emergency, the majority has once again failed to find appropriate funding. And again, this is an issue that I know has bipartisan support. I've worked with my colleagues here on the other side of the aisle to try and address this issue. And yet it has not been a priority, just like funding the children's health insurance and the community health centers and other health care initiatives. The special diabetes program have not been a priority for funding. This is an enormous lost opportunity. We could have written bipartisan legislation to address all of these issues, and we could have fully authorized in a timely manner critical health programs that tens of millions of Americans rely on. We could have addressed the opioid emergency, which is ravaging communities across this country. But instead, what did we get? We got a tax bill that makes a mockery of reform. It makes the tax code more complex, not less. It will grow the deficits in our national debt. And instead of helping the middle class and reducing the complexity of our outdated tax code, it creates a bonanza of new loopholes for the large corporations and the wealthiest in this country. Now, the majority here in the Senate had no problem coming up with $1.5 trillion in unpaid-for tax cuts for the biggest corporations in this country. And in the final days before passing the tax bill, they had no problem creating a new $700 million loophole for oil and gas partnerships that will benefit oil giants like Shell and Valero. They had no problem creating a new loophole for wealthy individuals with large real estate holdings, a loophole that's been described as a jackpot for the Trump family and for several members of Congress. They had no problem retaining the carried interest loophole at a cost to the Treasury of $20 billion. I remember during the campaign when candidate Donald Trump railed against the carried interest loophole as a giveaway to Wall Street that was unfair to American workers. Again and again, candidate Trump promised to kill this loophole, but President Trump now enthusiastically supports keeping it in the tax bill. Well, yesterday at the White House, Republican leaders and President Trump celebrated the tax bill, while at the same time, many in the majority party insist that the federal government can't afford to help 9 million children who depend on the CHIP program and tens of millions of working Americans who rely on community health centers or the Affordable Care Act for access to health care. Well, according to a study by the Bipartisan Joint Committee on Taxation released this week, by the time many of the provisions of this tax bill expire in 2027, large corporations and the wealthiest Americans will continue to enjoy the massive permanent tax cuts, because those cuts are not set to expire. But almost every income group below $75,000 will see tax increases by 2027. Make no mistake, this tax bill is a betrayal of middle-class Americans, and it is especially a betrayal of tens of millions of Americans who place their faith in President Trump. This tax bill is also a case of sadly misplaced priorities. The majority in Congress have been single-mindedly focused on passing this bill at every step, adding more and more giveaways to large corporations instead of working across the aisle to focus on the needs of the middle class. And meanwhile, they have shortchanged the children's health insurance program, they have shortchanged community health centers, and they have shortchanged the special diabetes program. They have caused hospitals and clinics across my state and across America to begin the process of reducing their services. This really demonstrates a lack of understanding and a total disregard for the needs and priorities of so many Americans. Well, yesterday, Republican leaders and the President celebrated the passage of their misguided tax bill. But senators who care deeply about regular order and bipartisanship in this body are not celebrating. Americans concerned about our national debt and our children's future are not celebrating. Americans who see growing income equality as a threat to our democracy, a threat made far worse by this tax bill, they're not celebrating either. And parents of the 9 million children who rely on the Children's Health Insurance Program, they're dreading notifications from their states that their children will no longer have health insurance. These families aren't celebrating during this holiday season either. Now, as I said earlier, the debate on this bill is over, but I intend to continue to speak out against this very damaging tax legislation, and I pledge to continue to speak out in support of the real needs of working people across America, including the need for affordable health care. And in the new year ahead, I certainly hope to be able to work with senators on both sides of the aisle to address these urgent needs. The American people deserve better than this legislation. They also deserve a Senate that values bipartisanship, that values cooperation and compromise in the service of all Americans, not just the largest corporations and the wealthiest in this country. Thank you, Mr. President. I yield the floor.